Problem is that many people don't know the difference. And that confusion causes two dangerous mistakes. Either people panic over normal changes, or they ignore serious warning signs for years. In this video, I'm going to help you clearly tell the difference between normal aging and possible health problems, using simple, real-life explanations. No fear. No diagnosis. Just clarity. And by the end of this video, you'll know when a symptom is likely harmless, and when it deserves attention. Welcome to Healthy Tea, the channel that helps you spot health problems early so you can protect yourself and the people you love. If you're new here, hit subscribe and tap the bell. We post simple, life-saving health tips. Quick question: are you watching at home, at work, or on a break? Tell me in the comments. Let's start with something important. Aging is slow. Normal aging does not happen suddenly. It does not change overnight. And it does not completely disrupt your daily life. Normal aging is usually gradual, mild, predictable. For example, you may take a bit longer to recover after physical activity. You may need more rest than you used to. You may notice small lapses in memory, like forgetting names briefly. But here is the key point. Normal aging does not stop you from functioning. You may move slower, but you can still move. You may forget small things, but you can still manage your life. You may feel tired sometimes, but rest helps. Now let's talk about what aging does not explain. Fatigue and aging. Feeling tired is one of the most common complaints people blame on aging. So let's separate the two. Normal aging-related fatigue usually appears after physical or mental effort. Improves with rest or sleep. Comes and goes. Does not feel overwhelming. You might say, I get tired more easily than I used to. That can be normal. But now let's talk about fatigue that is not normal. Fatigue may be a health concern if it lasts for weeks or months. It is present even after rest. You wake up feeling exhausted. It affects concentration or motivation. It interferes with daily activities. This kind of fatigue feels less like being tired and more like being drained. It can be associated with things like low iron levels, vitamin deficiencies, thyroid problems, chronic inflammation, poor sleep quality. Here's a simple question to ask yourself. Does rest restore your energy? Or does exhaustion follow you all day? That difference matters. Next symptom is pain and body aches. Many people believe that pain is simply a normal part of getting older. They say things like, my knees hurt because I'm aging. My back aches because I'm getting older. But let's be clear. Pain is not a normal requirement of aging. Yes, aging can bring changes to muscles and joints. Yes, recovery may take longer than it used to. But constant pain, worsening pain, or unexplained pain should never be automatically dismissed. So let's separate what is normal age-related discomfort from pain that deserves attention. Normal age-related discomfort often feels more like stiffness, especially in the morning. You may wake up feeling tight or slow. But once you move around, stretch, or start your day, the discomfort improves. This kind of discomfort is usually mild, predictable, and affects both sides of the body equally. For example, both knees may feel stiff. Both shoulders may feel tight. And importantly, this discomfort does not rapidly worsen over time. Now let's talk about pain that is not normal. Pain may be a sign of a health problem if it feels sharp, severe, or deep, rather than dull or stiff. If pain is getting worse week after week, instead of staying the same or improving, that matters. Pain that wakes you up at night or prevents you from sleeping comfortably is another important warning sign. So is pain that comes with swelling, redness, warmth, or weakness in the area. Another red flag is sudden pain without an obvious injury. If you didn't fall, twist, or overuse a muscle, yet pain appears suddenly, it deserves evaluation. One of the most overlooked signs is this: pain on only one side of the body. Pain that affects just one knee, one hip, one shoulder, or one side of the back, is often not explained by normal aging alone. And here's the key message to remember: aging may slow recovery, but it should not create constant pain. And it should never cause pain that keeps escalating. Listening to pain early is one of the best ways to protect long-term mobility and independence. Memory and brain changes. What's normal versus what needs attention? This is one of the most sensitive health topics to talk about. And because of that, it's important to approach it calmly, clearly, and without fear. Everyone forgets things sometimes. And yes, some memory changes are a normal part of aging. Normal age-related memory changes often include occasionally forgetting names, taking longer to recall information, needing reminders or notes, but still being able to live independently. For example, you might forget where you placed your keys, then remember later. You might struggle to recall a name at first, but it comes back to you after a moment. That can be normal. What matters most is this: your memory still works, just a bit slower. You can still manage your day. You can still follow conversations. You can still make decisions and take care of yourself. Now let's talk about memory changes that may be more concerning. These are not just moments of forgetfulness. They involve changes in function. For example, getting lost in places you know well, repeating the same questions or stories over and over, having difficulty following conversations or instructions, struggling with daily tasks you used to handle easily, or noticeable changes in personality, mood, or judgment. This is the key difference. It's not just about forgetting. It's about how memory problems affect daily life. Here's something very important to hear. Not every memory issue means something serious. Stress, poor sleep, medications, anxiety, and fatigue can all affect memory and concentration. But patterns matter. Progression matters. And impact on daily life matters. If memory changes are becoming more frequent, more noticeable, or more disruptive, that's when they deserve attention. So here's a simple way to think about it. Occasional forgetfulness can be normal, but losing function is not. Awareness, not fear, is the goal. Weight, appetite, and digestion. Let's talk about weight, appetite, and digestion because this is where many health changes first appear. And as you listen, I want you to do something simple. Mentally answer the questions I ask. No pressure to comment, just notice what feels familiar. As people get older, metabolism tends to slow slightly. That means weight may increase more easily, even without major diet changes. Appetite may also change. You might feel full sooner. You might eat smaller portions than you used to. Occasional bloating or mild digestive discomfort can also happen. Now pause for a moment and ask yourself: have these changes happened gradually over years? If yes, that can be normal. These changes are usually mild and stable. Now let's talk about red flags. Here's where we need to be careful. Unintentional weight loss is not normal aging. If weight drops without changes in diet or activity, that is a warning sign. Loss of appetite that lasts for weeks is not normal. Persistent digestive symptoms such as daily bloating, ongoing constipation, frequent diarrhea, or constant stomach discomfort are also not normal. Quick check for you. Has anything changed suddenly? Sudden changes matter. Unexplained weight loss is never something to ignore, regardless of age. Digestive symptoms are often dismissed as something I ate. But persistent symptoms tell a different story. Ask yourself, do you feel bloated most days? Do digestive issues interfere with daily activities? Do symptoms keep returning despite simple fixes? If the answer is yes, your body may be signaling a deeper issue. Appetite is closely linked to overall health. Reduced appetite can be related to chronic inflammation, hormonal imbalances, digestive disorders, medication side effects, emotional health changes. This is why appetite loss should never be ignored, especially when it's new. Quick reflection. Is your appetite change recent or long-standing? Recent changes deserve attention. While weight gain can happen with age, unexplained or rapid weight gain can also signal health problems. Fluid retention, hormonal changes, or metabolic issues may be involved. Again, focus on patterns. Gradual change may be normal. Rapid or unexplained change is not. The most important takeaway: your body communicates through patterns, not isolated events. Normal aging changes are gradual, predictable, manageable. Health-related changes are persistent, progressive, disruptive. And the difference matters. Before we move on, ask yourself one final question. Have I adjusted to changes, or ignored them? Awareness is the first step to prevention. Sleep and energy patterns. Sleep and energy levels are some of the first areas people blame on aging. Many people say, "I don't sleep like I used to," or "I'm tired all the time, it must be age." But while some changes in sleep are normal, persistent exhaustion is not. So let's clearly separate normal aging changes from health-related problems. What can be normal with aging? As people get older, sleep often becomes lighter. You may wake up more easily during the night. You may go to bed earlier and wake up earlier. And you may spend less time in deep sleep. These changes can happen gradually and still allow you to function well during the day. Normal age-related sleep changes do not cause constant daytime exhaustion. You may feel slightly less refreshed than before, but you should still have usable energy. What is not normal aging? Constant poor sleep is not normal. Difficulty falling asleep every night. Waking up frequently and feeling unrefreshed. Needing naps just to get through the day. These are not typical aging changes. Excessive daytime sleepiness is especially important. If you feel tired despite sleeping, if energy never returns, even after rest, that is a warning sign. Common health conditions that affect sleep and energy. Many health conditions affect sleep long before other symptoms appear. Sleep disorders such as sleep apnea can cause repeated nighttime awakenings without you realizing it. Hormonal imbalances, including thyroid problems, can disrupt sleep and energy regulation. Vitamin deficiencies, especially iron, vitamin B12, and vitamin D, can cause persistent fatigue. Chronic stress and anxiety also interfere with sleep quality, even when sleep duration seems adequate. Daytime sleepiness is a red flag. Occasional tiredness happens to everyone. But persistent daytime sleepiness is different. If you struggle to stay awake during normal activities, if you feel mentally foggy most of the day, if you rely heavily on caffeine just to function, these are not signs of aging. They are signs that something deeper may be affecting your sleep or energy systems. Pay attention to patterns, not isolated days. Normal aging-related fatigue comes and goes. It improves with rest. And it does not progressively worsen. Health-related fatigue is more consistent. It lingers. And it often gets worse over time. Patterns tell the story. A critical reminder. Sleep is not a luxury. It is a core biological function that affects immune health, brain function, heart health, mood and emotional stability. Ignoring sleep and energy problems allows other health issues to develop quietly. The key factor is change over time. If sleep quality or energy levels have declined noticeably, If the change is persistent. If it affects concentration, mood, or daily functioning. That is not normal aging. That is your body signaling that something needs attention. Emotional and mood changes. Emotional changes are one of the most misunderstood parts of aging. Many people assume that feeling sad, irritable, or withdrawn is just part of getting older. But that assumption causes important warning signs to be missed. So let's clearly separate what can be normal from what deserves attention. What can be normal? As people age, emotional responses may change slightly. You may prefer quieter environments. You may feel more reflective. You may become less interested in constant social activity. Occasional sadness, especially after loss, retirement, or major life changes, can also be normal. The key point is this: normal emotional changes do not remove interest in life. They do not eliminate enjoyment. And they do not interfere with daily functioning. What is not normal aging? Persistent emotional changes are not normal. Feeling down most days. Losing interest in activities you once enjoyed. Withdrawing from people on a regular basis. These are not signs of aging. They are warning signals. Irritability that feels constant. Mood changes that are new or worsening. A sense of emotional numbness. These changes should not be ignored at any age. Depression is not just getting older. Depression is often overlooked in adults because symptoms can look different. It may not show up as crying or sadness. Instead, it may appear as fatigue, loss of motivation, changes in sleep, increased physical complaints, lack of interest in social interaction. Because these symptoms overlap with other health issues, they are often dismissed. But depression is a medical condition, not a personality change. And it is treatable. When mood changes signal a medical issue. Sometimes emotional changes are not psychological alone. They can be linked to physical conditions such as thyroid disorders, vitamin deficiencies, chronic inflammation, sleep disorders, hormonal imbalances, side effects of medications. This is why emotional changes should never be dismissed without evaluation. The mind and body are deeply connected. The key factor is change. If someone's mood is noticeably different from their usual self, if the change is persistent, if daily life is affected, that is not normal aging. That is a signal worth listening to. Now let's talk about the most important part of this video. Because while some changes can be explained by aging, some symptoms should never be explained away. There are certain signs that are not part of normal aging. No matter how old someone is. These symptoms often signal that the body needs immediate attention. Not observation. Not waiting. And not excuses. One of the biggest warning signs is sudden change. Aging is a slow process. It happens over years, not days. So when symptoms appear suddenly, or change rapidly, that is not aging. Sudden physical decline, such as a sharp drop in strength, balance, or coordination, is not normal aging. Sudden mental decline, such as confusion, disorientation, or difficulty speaking, is also not normal aging. New neurological symptoms deserve urgent attention. These include sudden weakness, numbness, tingling, vision changes, difficulty speaking, or loss of coordination. Another category that should never be ignored is chest pain. Chest pain is not an aging symptom. Neither is pressure, tightness, or discomfort in the chest. The same is true for shortness of breath, especially if it is new, sudden, or worsening. Feeling winded after years of stability is not something to ignore. Unexplained bleeding is another major red flag. This includes blood in stool or urine, coughing up blood, unexpected vaginal bleeding, or bleeding that does not stop easily. Persistent fever is also not aging. A fever that lasts for days, or keeps returning without explanation, suggests infection, inflammation, or another underlying problem. Sudden weakness or numbness, especially on one side of the body, is one of the most critical warning signs. This can affect the face, arm, or leg, and should always be treated as urgent. Here is the principle to remember. Aging is slow. Sudden changes are not aging. When symptoms appear quickly, progress rapidly, or feel dramatically different from your usual baseline, they deserve immediate attention. Recognizing this difference can save health, function, and in some cases, life. Knowing when to seek medical advice can feel confusing. Many people hesitate because they don't want to overreact. Others delay because they assume symptoms will pass. But seeking medical advice is not about fear. It's about clarity. If you're unsure whether a symptom is normal or not, there are 3 simple questions that can help guide your decision. The first question is this: is this getting worse? Normal age-related changes tend to stay mild and stable. They may fluctuate, but they don't steadily progress. If a symptom is increasing in intensity, happening more often, or spreading to new areas, that is a signal worth paying attention to. The second question is this interfering with daily life? A symptom becomes more important when it affects your ability to function. If it disrupts sleep, limits movement, reduces concentration, or changes your routine, it deserves evaluation. Health concerns are not defined only by pain. They are defined by impact. The third question is this new or unusual for me? Your personal baseline matters. Something that is normal for one person may be very unusual for another. If a symptom feels different from what you've experienced before, appears suddenly, or doesn't follow your usual pattern, it's reasonable to ask questions. Here is the key point to remember. If the answer is yes to any one of these questions, it is reasonable to seek medical advice. Not because something is necessarily wrong, but because you are being informed and proactive. Early evaluation does not mean bad news. Most of the time, it provides reassurance, guidance, or simple solutions. And when there is something that needs attention, catching it early almost always leads to better outcomes. Listening to your body is not overreacting. It is responsible care. Thank you for staying with me through this video. I know health topics can feel overwhelming, but the fact that you're watching shows you care about your well-being. By paying attention to these details, you're taking control of your health, something that many people overlook. If you found this helpful so far, keep watching. In the next sections, we'll dive into changes that are never normal at any age and how recognizing them early can make a real difference. Staying curious and informed is one of the best ways to protect yourself and the people you care about. We've already talked about symptoms like fatigue, pain, sleep issues, and memory changes. But there's something just as important that often gets overlooked. Many health problems don't begin with dramatic symptoms. They begin quietly, gradually, and often, they are explained away with a single phrase. It's just age. That phrase sounds reasonable, even comforting. But in medicine, assumptions are risky, especially when they delay attention to changes that are not normal at any stage of life. Now let's go deeper into why this assumption can be dangerous, which symptoms are most often overlooked, and how to think about aging in a safer, more informed way. As you listen, don't try to diagnose anything. Instead, focus on awareness. Let's look at why humans normalize decline. Humans are remarkably good at adapting. We adapt to discomfort. We adapt to limitations. We adapt to gradual decline. This ability has helped humans survive for millennia. But in health, this adaptability can be dangerous. When changes happen slowly, the brain reframes them as normal. What once would have felt unusual becomes expected. What once was inconvenient becomes manageable. What once was concerning becomes something to live with. Reduced tolerance? Suddenly it seems like just how it is. Lower capacity? It feels realistic. Symptoms? We quietly ignore them or shrug them off. Take a moment and reflect. Have you noticed changes you barely even recognize anymore? Things you once questioned but now accept as normal for my age? This psychological adjustment is one of the biggest reasons health issues go unnoticed for years. Your body may be signaling subtle warning signs, but your mind has adapted. The result? Silent acceptance becomes the barrier to early detection. Here's a gentle reminder. The problem isn't aging. The problem is normalizing what could be preventable or treatable. Ask yourself again. Are there small changes in your energy, sleep, memory, or mood you've just lived with? Could some of these changes deserve attention instead of silent acceptance? Awareness is the first step. Recognizing the difference between adaptation and true aging is the key to protecting your health. Now let's discuss one of the most overlooked warning signs of health issues: loss of function. Notice I didn't say pain or fatigue. Loss of function is different and often more important. Healthy aging preserves independence. You should still be able to manage your daily life, perform tasks you've always done, and recover from minor setbacks without significant struggle. Some examples of functional decline include difficulty performing tasks that were previously easy, like cooking, cleaning, or managing finances. Reduced coordination or balance, tripping more often, struggling with stairs, or feeling unsteady. Slower recovery after minor illness, taking longer to regain strength or energy. Needing more assistance for routine activities like dressing, bathing, or running errands. Now let's pause for a moment. Ask yourself silently. Have I noticed any of these changes? Even small differences matter. It's easy to blame these issues on age. We often say things like, "I'm just getting older," or "it's normal at my age." But here's the reality: normal aging should not take away independence. Progressive functional decline is never just age. If you or a loved one are noticing these changes, it is a signal that deserves evaluation. Another interactive moment. Think about your day yesterday. Did any tasks take more effort than usual? Did you need help with something you usually handle alone? If your answer is yes, your body might be giving you a subtle warning. Small changes can be easy to dismiss, but patterns are important. If function is gradually declining over weeks or months, that pattern is significant. Remember, the goal is not to alarm you. It's to increase awareness, so changes are noticed early when interventions are most effective. Digestive and metabolic changes are among the most commonly dismissed symptoms. Many people assume that small discomforts are just part of aging. You may have heard statements like, "My stomach is just sensitive now. I don't digest food like I used to. I've adjusted my eating, so it's fine." But here's the key point: persistent digestive disruption is not an inevitable part of aging. Let's break it down. Chronic changes, things that happen day after day, week after week, in digestion, bowel habits, appetite patterns, or food tolerance may reflect underlying health issues rather than normal aging. These could include inflammatory conditions, like irritable bowel or chronic gut inflammation. Hormonal changes affecting metabolism. Malabsorption or nutrient deficiencies. Medication side effects. Early signs of systemic disease. Here's a question for you: have you noticed digestive discomfort that lasts longer than a few days or weeks? Mentally check in with yourself, don't worry about commenting yet. Just notice. Another point to consider: adapting your lifestyle to symptoms does not mean the cause is harmless. For example, skipping foods, changing meal times, or avoiding social meals may temporarily reduce discomfort, but your body is compensating, not healing. Ask yourself: do I frequently feel bloated, gassy, or full? Have I noticed a change in bowel habits that doesn't resolve? Do I avoid certain foods to feel normal? These patterns are your body's way of communicating that something is off, even if it doesn't feel urgent. Early evaluation can clarify whether these changes are benign, nutritional, or signals of a deeper issue. Remember, metabolic and digestive changes shouldn't be written off as just age. Your body is giving you signals, and paying attention now helps prevent more serious problems later. Weight change is one of the most visible biological signals the body gives, and yet it is often ignored. Many people assume, "I'm just getting older, that's why my weight is changing." But that assumption can mask important health issues. Unintentional weight loss is never normal aging. If your weight drops without changes in diet or activity, that is a signal your body is giving you. Similarly, unexplained weight gain, especially if it's rapid, sudden, or disproportionate, also deserves attention. Quick reflection for you. Have you noticed a sudden drop in weight? Or a rapid increase you didn't expect? If yes, it's worth evaluating. Weight isn't just a number on the scale. It reflects core biological processes, including hormonal balance. Hormones control appetite, metabolism, and energy storage. Metabolic health, your body's ability to process calories efficiently. Digestive efficiency, nutrient absorption and gut function. Inflammatory activity, chronic inflammation can cause unintentional changes. Interactive moment. Take a second and ask yourself, has my weight changed without me trying? If the answer is yes, that's not aging. That's your body signaling something important. Ignoring unexplained weight changes because of age can delay diagnosis of conditions that are often treatable when caught early. Early awareness allows for interventions that can improve energy, metabolism, and overall health. So remember, gradual, expected weight changes with age are normal. Sudden, unexplained, or significant changes are not. Paying attention now could make all the difference. Emotional and behavioral shifts. Not all health changes are physical. Behavioral and emotional shifts are frequently overlooked, yet they can signal important health issues long before other symptoms appear. These shifts may include withdrawal from activities you once enjoyed, reduced motivation or initiative, emotional flatness or irritability, changes in decision-making or judgment. Many people dismiss these changes as just personality or normal aging. But here's a critical point: personality does not suddenly change without cause. If someone you know, or even you yourself, experience persistent emotional or behavioral shifts, this can indicate underlying medical, neurological, or metabolic issues. These are signals your body is giving you. They deserve attention, not dismissal. Let's pause for a moment and reflect. Have you noticed yourself doing less of the activities you enjoy? Have you found it harder to get started on projects or daily tasks? Have friends or family mentioned changes in your mood or behavior? Answering these questions honestly is not judgment, it's self-awareness. It's also an important step in recognizing early warning signs, because emotional and behavioral changes often precede physical symptoms. The key is patterns over isolated incidents. A bad day? Normal. A week of low motivation? Worth monitoring. Persistent shifts over months? Seek evaluation. Remember, taking action early allows for better outcomes, whether it's medical evaluation, lifestyle adjustments, or mental health support. Your body communicates in subtle ways. Emotional and behavioral shifts are just as meaningful as physical changes. They are clues, not coincidences. Pay attention. Observe the pattern. And never dismiss persistent changes as just aging. Sensory and perception changes. Changes in sensory perception are another area where age is often blamed too quickly. Many people assume that altered taste, changes in vision, or sensitivity to noise are just part of getting older. But that assumption can be dangerous because it may delay attention to real health concerns. Some sensory changes can indeed occur gradually with age, such as slight changes in taste or smell, minor differences in vision clarity or contrast, mild sensitivity to bright lights or loud sounds, slightly reduced spatial awareness. These changes are usually slow, subtle, and do not interfere with daily life. But here's an important principle. Sudden or progressive changes in your senses are not normal. If you notice a rapid decline in vision, a sudden inability to smell certain foods, or increased difficulty judging distances, that is not just aging. Sensory systems are closely linked to neurological and vascular health. A sudden change can be an early signal of conditions like neuropathy, stroke or transient ischemic events, sensory processing disorders, vitamin deficiencies. Ignoring these changes and attributing them to age can delay critical intervention, sometimes for months or even years. Now, let's make this interactive. Have you recently noticed food tasting differently than before? Are bright lights or sounds more uncomfortable than they used to be? Do you bump into objects or misjudge distances more often? Take a moment and mentally check off any changes. Even if changes feel small, tracking them over time matters. Another quick reflection. Are these changes happening gradually over years, or suddenly in weeks or months? Gradual, mild changes are often normal. Rapid, noticeable changes deserve evaluation. The key takeaway here is simple. Normal aging can slightly affect your senses, but sudden or progressive changes are signals your body is giving you. Paying attention early can protect your neurological and vascular health and improve your quality of life. Now, let's take a moment to pause and reflect. Because there is one question that matters more than any age number. The most important question is not, how old am I? Age is just a number. It tells us nothing about the changes happening inside your body, mind, and energy. The question that matters is, what has changed? Ask yourself, have my energy levels changed? Has my sleep pattern shifted? Have I noticed new aches, pains, or discomfort? Has my mood or motivation changed? Take a moment. Mentally check in. Even pause the video if you need to. Because change is the signal. Aging is predictable. It happens slowly over time. Gradual shifts in energy, sleep, or memory are usually normal. Disease, on the other hand, is disruptive. It interrupts your baseline, creates sudden deviations, and affects function. Healthy aging maintains stability. Your body may slow down slightly, but the baseline remains consistent. Health problems create deviation. Your body starts sending signals that something is off. Sometimes subtle. Sometimes obvious. Here's a question for you. Can you think of one symptom you've noticed recently that seems unusual for you? Write it down or just keep it in your mind. This is the starting point for awareness. Your personal baseline matters more than average statistics. Two people of the same age may experience very different levels of energy, strength, or cognitive function. When something deviates from your baseline, it matters. Even if you're in your 60s, 70s, or 80s, new or unusual changes are signals to pay attention to. Here's another reflective question. If you experienced this change last week, last month, or last year, how does it compare to your usual self? Is it persistent or just a one-off occurrence? Age does not cancel out symptoms. In fact, it makes awareness even more important. Ignoring changes because it's just aging can be dangerous. Instead, your age should prompt you to listen more closely, to track patterns, and to seek clarity when something is different. Ask yourself continuously, what has changed? Is this normal for me? Does this interfere with my daily life? This mindset transforms how you approach health. It shifts the focus from fear of aging to actionable awareness. Remember, gradual, mild, predictable changes usually normal aging. Sudden, disruptive, or persistent changes potential health concern. By focusing on change, you become your own best observer. You are no longer guessing. You are noticing patterns. You are proactive. Before we close this section, here's one final interactive prompt. Take a moment and list mentally 3 things that have changed in your body, mind, or mood in the past 6 months. Ask yourself, are these gradual and predictable, or sudden and disruptive? This reflection is more valuable than any number on a birthday cake. It's the foundation for preventing health problems before they escalate. The key takeaway: age is a number. Change is a signal. Awareness is your tool. Let's bring everything together. Aging is a natural process. And most age-related changes happen slowly. You may notice gradual shifts in energy, sleep, or memory over time. These changes are usually mild, predictable, and stable. Health problems behave differently. They tend to progress. They tend to disrupt daily life. And they tend to follow patterns, not isolated moments. One bad day does not define your health. But repeated changes over weeks or months do. That is why patterns matter more than individual symptoms. Another key difference is speed. Normal aging is gradual. Sudden changes, physical or mental, are not aging. New pain, rapid decline, unexpected weakness, or sharp changes in function should always be taken seriously. Aging does not mean accepting unexplained decline. It means staying attentive to change. Not every symptom is serious. But no symptom should be dismissed automatically. The phrase "it's just age" should never end the conversation. It should start a better one. Thank you for watching. Take care of your body. It's the only one you have. Share this video to people who may need it, and don't forget to subscribe.